Hi, this is Eric Stoller for the Eric Stoller Show here at Studio 111. We're here with Christian Drapeau, the founder of STEM Regen, one of the top companies in the anti-aging market. They've been around since 2016. They hit the US market in 2021. I'm so honored to have Christian here on behalf of our good friend John Hyland at Top Doctor Magazine, as I'm part of the magazine, and I want to thank you for being here. And it's such an honor to have you. And I've seen your product. I see you guys at the events making like a big push everywhere. But more importantly, my thing in interviewing people is because Man on a Mission is my platform, and I'm really intrigued by people that have a mission. I go back to, if you're familiar with Peter Drucker, not Peter Drucker, but Tom Peters. You remember Tom Peters? And he says, any business, he says, there's always what we call a monomaniac on a mission. There's always one person who is super highly focused to get the result, right? Isn't it true? We all have our own mission. So I really want to know about the mission, but first I want to know a little bit about you, kind of where you got started that brought you to where you are a leader in this field, and we'll talk more about cellular repair. And now being here in Florida, everybody's the talk of stem cells. And we know it's real. A lot of people aren't in the know, and not all stem cells are the same. But you also own a product that, that is already out there that people are using regularly, and it's in a capsule form. I've actually had a chance to use it as well. So welcome. And so Christian, tell us about your real where we got started.
Okay. So my background is brain research, neuroscience. So I was at the Montreal Neurological Institute, essentially doing research on memory and epilepsy. I've been fascinated with the mind since I was a kid. So that's what led me to the whole field of neuroscience. And at some point in this whole journey, I was hired by a company that was selling a blue-green algae that grows naturally in a lake in southern Oregon.
Okay.
So you may have heard of the product. Like 20 some years ago, it was called super blue-green algae.
Oh yeah, sure.
There you go. So I was hired as the director of R&D for this company, and this was right after the passage of the DSHEA, the Dietary Supplement Health and Education Act. And my task was to document the mechanisms of action of this blue-green algae so that they had a scientific message to support their marketing claim. So I started to investigate this blue-green algae. We very, very quickly identified its effect on inflammation, its effect on the immune system, its effect on the mind, which were the three main benefits that people were reporting.
Sure.
But I came across people reporting reversal of multiple sclerosis, of insulin-dependent diabetes, Parkinson, severe emphysema, repair from stroke. I mean, it was just
from the blue-green algae. Amazing.
And it was, you just hear stories. They don't have any like scientific value. But 10 stories is something, 50, it starts to get a little bit more interesting. And as the number grows, and for some of those, I actually had access to their medical files. I could see really what had changed. And we're talking about conditions where normally medicine says, well, that's it. Like there's nothing that medicine can do for you. And these people experience quite significant improvement. So the turning point was when I came across, it's a lady that sent me a photo album. And with a letter with it, she's describing that when she was 12, she was walking with a kerosene lamp. She tripped and she burned herself on the face, chest, and arm, 3rd degree. So
Wow.
she was scarred her entire life. And at age 60, so 50 years later, at age 60, somebody gave her this blue-green algae. So she started to take it, and she said it started first, my scars started to get inflamed, red, itchy, but she said it felt to her healing itchiness. So she kept taking the product. She took a picture of herself in the mirror every week, and she ended the letter by saying, go and look at the photo album.
Wow.
And as I'm going through
So Christian, I want to talk a little bit about like the difference between stem cells, because today here in Florida, now that the laws have changed, we're able to like use live stem cell, cord blood, versus our own stem cell and what stem regen does, which is really talking about repairing of the cells, just as we were discussing with the blue gene algae. Can we talk a little bit about that?
I mean, it's there's a lot of layers to that question.
Okay.
And there's a lot of marketing into all these messages. So what I want to do with you is like dive into the data and what is reality here. So there are different types of stem cells. It is true that your stem cells as a 50-year-old are not as good as the stem cell of a newborn, no question.
Sure.
So you take a, let's say, a midlife mouse, and you trigger an injury, and then you inject in that mouse stem cells from a geriatric mouse or from a newborn mouse, and the earlier stem cells are definitely more effective. And that has led to a message that we find pretty much across all the stem cell world, which is past, let's say, 40, 50 years of age, your stem cells are worthless, so you need to get umbilical cord stem cells. That conclusion is entirely false. The premise is true. Your stem cells are not as good when you're older. However, we have a study, for example, that we published just about a year ago with our product, which just triggers the release of your own stem cells. That's all it does. And it's a study on stable chronic congestive heart failure. So we have people 65 to 75 years old. And all we do, so they have chronic stable congestive heart failure. So wherever they are, it's what medicine could do for them. And all we do is that we make them trigger their own stem cells, the release of their own stem cells, 3 times a day for 6 months.
Okay.
All 10 with their 75-year-old stem cells, all 10 of these first patients had normal heart function 6 months later.
Amazing.
So the point is that they're not as effective yet. Stimulating these stem cells every day, they're effective enough to amount to something significant. A little bit like if I ask you, are you running as fast as when you were 15?
Right, of course
No.
not.
Are you irrelevant? No.
Right, no, right.
So it's a little bit in that realm that we need to position the question. But if you do get a stem cell injection, then you have access to your own or umbilical cord. So umbilical cord stem cells will be more effective than your own. So the question is, how often can you do this? And that is also part of your decision. If you say, I'm getting one, go for umbilical cord. If you say, no, I want to have a bank of these cells and I want to do this like twice a year for the rest of my life, then yeah, do one with umbilical cord stem cells. But over time, yours will work also just as fine.
So, Christian, I wanted to ask you in terms of some of the regenerative clinics, especially here in Florida, that are doing stem cell and exosome treatments. How is the stem regen product integrating with them with their patient protocol?
It's integrating like super well. Like from the early days, before even doing stem regen, when I had previous formulas, we started to see early on that if you combine both together, that's when you get the best results. And that's why this heart study that we're doing, we have 3 groups. One group is stem regen release, this blend of plant extract that trigger the release of your own stem cells. This is one group. We have another group, adipose stem cells injection, and we have another group, the combination of both, because we wanted to document what we had seen over the years in clinics. And the result is very clear. You get by far better results by combining both.
Okay.
And releasing your own stem cell injection, it's somewhere it's comparable. So if I were to take, like, summarize all that data in one statement, I would say, if you can afford a stem cell injection, you should do this with stem regen release. This is how you get by far the best results. If you cannot afford it, releasing your own is a significant alternative that you can use. So that's the message that we bring with the data to clinics, and we have more and more clinics now. That's what they're doing. They basically, they do a stem cell injection, and in the package they have the people leave with 3 months of stem regen release, and it just basically, it supports the outcome, the impact of that injection.
Yeah, no, I think it's very powerful. I had gotten an IV back in December. And so part of it was, hey, this 5 weeks, like the stem cells now, I haven't even gone through 5 weeks yet.
Mm-hmm.
And so we had some other people like, hey, I don't feel anything yet, but also was like, hey, you got to relax. There's a lot of things you got to do. Obviously, I haven't been utilizing the stem regen product, but I think that would be critical. And as looking at the different formulas, because I know you have different for sports performance. Mm-hmm. Can we share a little bit about that with me, about the different formulas and what, like, if I'm looking at it like, hey, I'm trying to improve myself as an athlete, or if I'm just really, you know, like your cardiac patients that are really just trying to have better function and be able to walk. I mean, I just did it with my dad. My dad had, he was 85 and he was having breathing issues. So we actually did a little nebulizer. Mm-hmm. And then all of a sudden he's like, I go, how you doing? He's like, hey, I feel pretty good. And I got him a stem cell, same thing. He's, you know, at 85, he's like, I'm not feeling it. You know, an 85-year-old man, he's like, I'm not feeling anything yet. So but I'm real curious because, you know, it is amazing what the stem cell does. And I really can share with us about the different formulas and how they like impact the body. And
so before, let me just paint the picture here, because the way that stem cells have been introduced to the marketplace and the way that people hear about stem cells, most of the time, it's a treatment. You go somewhere and it's sort of the new treatment that now many clinics are doing. So you go there, and the stem cells that mean something in your life, you think that it's only those stem cells that you just got, you know, an injection with. And it's not really what the reality is. Stem cells are literally the repair system of the body. Just like you have an immune system, you have a repair system. The red marrow that is making your stem cells converts very quickly in our lives into fatty marrow that does not make stem cells. By age 30, or at some point in your 30s, the number of stem cells circulating in your bloodstream available to participate in tissue repair has dropped about 90%.
Wow.
So and we all experienced it. You know, somewhere in our 30s, you realize, I'm not recovering as fast as I used to. So this is your overall ability to repair. As this ability to repair goes down, then anything that is happening in your body that is so-called degenerative, just a simple wear and tear, now there's not enough repair to compensate it. And now it starts to show up in life. And it show up in many, many different ways. And we pay attention to those that are diagnosed. Like you're talking about your father. You'd say he's expecting results for one thing. I don't know, his knee pain, his hip pain, whatever it is.
Right.
But there's a lot of things that have gone down in that body
over
time. So we need to take one step back and just realize stem cells are the repair system of the body. That system goes down as we age, and now everything is starting to pay the price of just normal wear and tear, aging, damage, all of this. So the moment you put more stem cells in circulation, they don't go to the thing that you want to resolve in your life. They start to repair everything in the body. So there's a lot of things that may take place that will have a huge impact on your health, but you may not feel it. Microvasculature, I mean, so many different aspects of the structure of various organs and tissues. That's what we want to achieve by putting more stem cells in circulation. So stem regen release will about double the number of stem cells in circulation. If you take a normal 50-year-old, it's roughly about 10 to 12 million stem cells at any one point in time in his 50-year-old's day. There's about 10 to 12 million stem cells in circulation. So we doubled that. That's why we say 2 capsules will release roughly 10 million stem cells. Do this for a month, that's 300 million of your own stem cells that you have released. So you start to see it gets significant over time. But the main question here is that why is it that some people, because sometimes the question is, are stem cells real? And it's the wrong question. I mean, the data is powerfully throughout the scientific literature, stem cells are real. The real question is, what stands in the way of stem cells to really do their job of repair in a specific person? Somebody gets an injection, they say it didn't do anything for me. Their stem cells is working, it works. Why haven't they experienced something? And there are two main reasons. Number one, as you age, your microvasculature goes down. So the delivery of stem cells that can be up to 30 microns to go into a 12 micron capillary, it's not an easy task. Your microvasculature must be very healthy and effective. And oftentimes when there's a chronic situation in a tissue, the first thing that goes down is the microcirculation. So you want to rebuild the microcirculation so that stem cells can be delivered everywhere. That's the product that we call Mobilize. So This is nattokinase that makes the blood more fluid for better entrainment. We have nitric oxide producer to dilate arterioles, small arteries, but the capillaries themselves, they're passive. So you need to build their flexibility and their ability to expand. So we have bioflavonoids, specific plant extracts shown to do this. And for cells to flow easily into a micro vessel, you need to have a good glycocalyx, the layer at the surface of capillaries. Sure. So we have in Mobilize, nattokinase, bioflavonoids, nitric oxide producers, and polysaccharides for rebuilding the glycocalyx. Amazing. So it's like it's a makeover of your microcirculation. Now the next thing that will prevent your stem cells, when you have released them or injected them, to go and find where they need to go is systemic inflammation. Inflammation is a signal that should be localized. Essentially, we have inflammation because the body is saying somewhere in your body, I have a problem here. Stem cells need to come here. But if stem cells don't have access, it does not repair. So it keeps screaming, send me stem cells here. These are inflammatory signals, and over time, they accumulate in your blood, and it becomes a chaotic signal that is no longer localized. It's everywhere in your blood.
So if you say that you're going to get a stem cell treatment, you're saying it might not be effective because of what's happening inside the body.
Correct. Okay. You want to help rebuild, let's say a month before, you want to help rebuild your microvasculature, and you want to suppress systemic inflammation simply so that stem cells can see where the problems are. It's a little bit like you having a few fires in your home. They're very small. They're not growing. They're staying there. And after a few weeks, your house is full of smoke. And now medicine thinks that the smoke, inflammation, is the problem. They call it inflammaging. It is a problem, but it's not the cause. The cause is places in your body where you have micro injuries, micro lesion, tissue damage, and it's calling for repair, but it does not receive effective repair. That's stem cells. So we have a product, Mobilize, that improves microcirculation, and we have Signal that suppresses all this chaotic signaling in the bloodstream so that stem cells can really see where they need to go. So if you do a stem cell injection, take Mobilize and Signal a month prior to the injection, and you're going to get much better outcome of that one injection. Okay. If you take Stem Regen Release, do the three together, and as released stem cells, you give them access to where they need to go to repair.
And you're saying you would do this a month before actually doing the protocol, taking the stem cell.
Correct. If you do stem cell injection, you do
an injection.
And you mentioned sports. The only difference with sport and release is that sport was NSF certified for professional athletes. So we're like athletes here, great difference taking the product. You repair much faster, you recover much faster. So that means you perform better over time and you don't have injuries. So professional athletes, that's a cool thing. So we certified the product called Sport in order to really bring this whole concept to professional athletes.
Now, so speaking about that from the performance side, what have you seen in terms of, I don't know if you're working with, with athletes in terms of their recovery time or even their ability to, run faster or lift more weights or whatever it may be and be more effective on the field? Because obviously we know in a lot of sports, in the past, people are doing stuff that way, whether it was testosterone or whatever they were getting for. But as they would always say, it doesn't matter if you give somebody the strength who doesn't have the talent, it doesn't matter, right? It's still not going to. So I'm curious, how in the world of performance has it really impacted, the athlete?
Yeah, it is huge. And that's why we're developing this effort here of really penetrating sports and professional athletes. And the explanation is not only it's simple, but it makes tons of sense. So it will increase performance, not because it's performance enhancing, simply because there is in the human body a protective system that if you have an injury to a muscle, a ligament, a tendon, like you have an injury somewhere in your body in terms of muscle and joints,
Hmm.
your body will inhibit the full contraction of that muscle so that you don't further damage that muscle or that tendon next time you do physical activity. So if you committing time, money, effort to go and train and work out, you cannot get the maximum outcome of this training because your body is inhibiting contraction a little bit. Plus, over time, whenever you get an injury, it happens at a place where you get many times smaller injuries that did not fully recover. So now take that concept and simply add now on top of your physical activity much faster recovery, meaning you create micro lesion when you go to the gym, when you work out. These micro lesions, when you come back the day after, you work on top of them. What if overnight you could increase the rate at which they repair because you put more stem cells in circulation? So
Sure.
that means the day after and every day that you go to the gym, you're working with a fresher body. So
Right.
now you can go further, more intense if you go on any physical activity. You get more out of that physical activity. You don't accumulate micro lesions, so you reduce your risk for injuries. And so faster recovery, reducing injuries. I've just named right now like the top two things that
Absolutely.
any professional athlete is trying to resolve.
Yeah, and again, you see how many athletes, you look at guys like Aaron Rodgers, sign a big contract, gets on the field, Achilles tendon, done for a whole season.
Hmm.
You hear about the kid who plays for the Broncos. They
Hmm.
play in overtime, broke his ankle at the end of the day. And so again, you start thinking about it as an average person running your day, and you travel
Hmm.
all over, and it's easy to get burnt out, and your body is going this way.
Yeah.
And so I'm a big proponent of how do you kind of keep yourself at a peak performance all
Yeah.
the time.
I
So,
think I think we're starting this work now. It has not been done, but
hmm.
I'm pretty sure this is what we'll see when we do the study. So we take, let's say, 50 professional athletes, and we count how many stem cells they naturally have in their bloodstream. This is
Okay.
their normal physiology. I guarantee when we link that data back to how many games have they left, how many times have they been off because they had an injury, I think we will see a straight
Absolutely.
relationship. People with fewer stem cells don't recover as well, therefore have more injuries and miss more games. So at the end of the day, as we're working to develop ways to make quantification of stem cells easy and people can do this anywhere in just about any lab, that means knowing how many stem cells you have will probably become one of the main data point that drafters will look at when they get a new player. So how is this kid ability to capable of repairing? And it's not a stigma because now we have a product with Stem Regen Sport
That's
where you
right.
can increase the number of stem cells every day to actually repair better. But it's going to be, give it a few years, it will become a thing. People
Yeah.
will want to know, where am I in my repair journey, my repair capacity, so that not only am I becoming optimal today, but I also prevent problems from down the road.
And I think a lot of it today, especially in this whole regenerative, and we call it the cash pay practice, it's all about preventative. I
Everything.
mean, most people, I have a cousin who's an ER doctor, and he's a very thin guy, and he says, and this is when I was heavy, he goes, most people that walk into this ER room don't look like him. They're not like that. Somebody that's overweight,
Mm-hmm.
they're not taking care of themselves, and you see it every single day. Having somebody that lost 100 pounds and now is been very involved, and just seeing average people that I know are the same age, and they go, oh my God, I can't believe it. And it's just, I made small shifts. All that other stuff just adds to it. And I do want to say that there is no magic
Mm-hmm.
pill. And I think one of the things that people have to realize, and I'm glad we talked about a little bit about, is this inflammation.
Mm-hmm.
And you're trying to get this stem cell or stem regen, but if your body is so inflamed, how are you going to get there? So, what do you recommend for like a detox, especially if they're going to get a better result from using your product? Or in general, like, hey, I'm trying to get to that next level of my body being,
Mm-hmm.
not only repair, but now I'm to the next level of performance.
Yeah, there's no doubt that detoxing before you get stem cell injection is going to be positive. It's
Hmm.
not something that I have studied, so I don't have any data. I don't know if there is data about it,
Sure.
but think of a stem cell as any cell of your body, but it's a super cell. So in order to function properly, it needs everything that a normal cell will need. So if you really want to prepare for before a stem cell injection, take this product that we have mobilized to rebuild the microcirculation, take signal to suppress systemic inflammation, and then start to take products to boost mitochondrial function, because one stem cell getting into a tissue is irrelevant. It's that stem cells getting into a tissue and multiplying and becoming, let's say, a million cells. That's what is relevant. This
Sure.
process of amplification is crucial, and it requires significant mitochondrial biogenesis. So start to also take things that are going to boost mitochondrial function: PQQ, coenzyme Q10, shilajit. These are good things to take. Start to take collagen peptides, because every single organ of your body, it's soft skeleton. It's a collagen-based soft skeleton. So when you repair a tissue, you have to repair also the sort of the framework of that tissue. So take collagen peptide at the same time. What you mentioned before, you just mentioned detox. So
Detox.
so
Yeah.
detoxing is super relevant. I mean, toxification or toxins in the body will affect any cells in your body,
Sure.
and your stem cells are super fragile. So you want to detox as well. All these things are great things to do as you prepare for a stem cell injection.
Absolutely. And in general, like I said, if somebody can't afford or cannot do it, obviously using the stem regen product is they start immediately.
Absolutely. You know, when I was writing this paper on what I mentioned before, like the reversal of congestive heart failure in
Which
these
is which is
individuals,
which is amazing.
it's amazing. But as I'm writing this paper, when you do peer review paper, you need to discuss your data within the scope of what is available in the
Yeah,
scientific
sure.
literature. So when I dove into the literature again, because I know that literature very well, and when I dove back into it, I was pleasantly surprised to see that nothing has really changed over the past, let's say, 10, 15 years in this regard.
Hmm.
Meaning the data that of the health outcome of releasing your own stem cells is still actually the most effective in terms
Wow.
of repair. The problem is that the compounds that were used pharmaceutically to do this can have severe side effects. So what we could see in animals and show in animals, we could not fully duplicate it into human beings. So
I
the
see.
effort shifted to injections. But now what we have is that now we bring a product that can help you trigger the release of your own stem cells. It's not a massive one-time release. It's a minimal release, or I would say moderate release, but you do this sustains over long periods of time. And what we find in the scientific literature of the impact of releasing your own stem cells is actually not just like a sort of a secondary strategy. It is a significant strategy for repair.
Yeah, and there are a lot of people that don't like
Mhm.
injections, and it maybe is not for them. And it's exciting hearing you talking about that. So that leads me to, where is the vision, the future, because I see your vision
Mhm.
of where STEM Regen is going, 2026 and beyond on your mission.
So right now we're completing a number of clinical trials. So we talked about congestive heart failure, we're doing Parkinson, we're going to start liver failure, COPD, not because like we have no intention to say take this product and it's going to cure you from heart
Of
disease.
course.
We have no intention of doing this. What we're trying to do is to show that the human body has a repair system. That repair system declines. You don't develop a disease because something degenerative has started in you and now it's growing. We develop a disease because this process has been in you since the day you're born, but your repair capacity has gone down. So now you've lost the balance. So now the degenerative process is no longer compensated by a repair process.
Sure.
So if we can put more stem cells in your blood circulation, we give back to your body its ability to repair, and we say, see what it can do for an organ that normally medicine says, past certain age, it cannot repair. And we want to say, see really the power of your body to repair. So we're completing this with a number of clinical trials, and everything that we've talked about here in this discussion, we need to bring this to the mainstream medical community, if you want,
Sure,
which is to
absolutely.
understand we develop problems not because something is developing, but it's because of a gradual failure of your endogenous ability to repair. So once we really bring this concept along with the ability to count how many stem cells there is in your blood, so that becomes really a risk factor, like it's a marker. You want to know how many stem cells you have. Bring all of this together, and we're basically changing the way that we practice medicine. That's kind of the mission that I'm on right now.
I love it. I think it's so amazing. And, having been being in the space and watching people that do miracles because the things you talk about, because of the world we live in, and they'll take a pill. I've had two stents put in when I was 46. And then my doctors give me different meds, and he's like, try this. He goes, I don't know if it's going to work or not. If you get a headache, let me know. And then when I went through all my weight loss, I'm now 59. So he's like, he took me up 90% of my medication. So we go talk to him. He used to be the head of cardiology at Aventura Hospital. So I look at myself being much younger than most of his patients, and then looking at my function to the point that I couldn't get a plus for a life insurance policy. At 59, I just got approved for a policy for something I'm doing. But more importantly, he looked at me like was so excited because it was repair. This was obviously because of the weight loss. So imagine adding, the stem cell treatment, I think helped, but now adding your product and just seeing so many people that they fall back and they just, they don't, even if they have a heart attack, they have a stent, they have put in, go 2, 3, 4 years down the road. What's that? That what scared me. A friend of mine said, hey, be careful because open heart surgery is next.
Yeah. I mean, what you described there would be like the topic of another podcast.
Yeah, sure.
Super, super important.
Absolutely.
The problems that you have and you get a drug for, what medicine does is just like masking the problem, changing the symptoms, changing the marker. It never goes to the source. Once you go to the source of the problem, in your case, it was the weight. Quite frankly, it's the problem for a lot of people.
Yeah, of course.
You go to the source of the problem, and suddenly all these drugs are not needed because your body can repair and can function optimally.
I had a calcified artery. I didn't know that, right? So, and then I kept getting back into the hospital, but it was a lot of anxiety. I'm in New Jersey. I'd gone there. I'm going to talk about this. My cousin has the same last name, Stoller. His wife had just passed. My ER doctor cousin sees me, and I got some like heartburn. Mm-hmm. He thinks I'm having an episode. He calls the ER, and they see the same house. They think, oh my God, it's the husband now. And I didn't go to the funeral. I spent the weekend in the hospital. You know what the doctor said to me? He goes, all these drugs, you'll be taking them for the rest of your life. Mm-hmm. And I was like, really? And I have been taking for many years, but I'm looking how many he's taken off. So you hit it that it masks the problem. I know, like, you go running and you're taking a blood pressure medicine. I'm never going to hit my optimal on my heart rate because it's suppressing my heart rate. Mm-hmm. And so I just say that somebody, in their 40s having a heart attack, and it happens commonplace all the time. I know people in their 30s and 40s, and most of them don't make it because their heart's still too strong. So I guess what I'm saying overall health-wise, or asking you, looking at the future where regenerative medicine is, what do you see as you're talking about cardiac and Parkinson's, and I'm hoping maybe you're doing some stuff with Alzheimer's as well. Where do you see the future of where regenerative is going and stem regen, with that? I see your mission with your trials, but overall.
Yeah, I think you touched on something that is super important. Like, you didn't mention it, but it was like in the background of everything that you just described, is that we live in the medical world today where if you've developed something, and let's say before age 50, even if you change your lifestyle and you improve, like, you cannot reverse.
Right.
Okay. You can't reverse. So,
right.
So the body cannot really cure and heal. This is how medicine works. If you were to really, like, say, reverse insulin-dependent diabetes, I've heard this 100 times. The doctor will say, well, the diagnosis was probably not right, or it's a miracle. And what we need to really now let it sink in is that, no, the human body has a repair system. Yeah. It has the ability to actually repair, but that declines as we age. So if you don't do anything about it, past 50 years of age, yes, your body cannot really repair because it just does not have enough of the juice to repair.
Right, sure.
But it's in you. So if we stimulate that repair juice, your body can resume a pretty remarkable ability to repair. And I'm sure right now you look at your overall health, quality of life, what you can do today compared to 10 years ago, and you are the proof that your body can repair.
Oh,
You're much
100%.
better now than you were 10 years ago.
100%. A lot of the
So
things that were chronically are gone.
so this needs to sink in, I think, in people's mind, in the medical community. We need to realize the human body has an ability to repair, has an ability to heal itself from problems. A lot of diseases considered like when you got them, that's it. You have them for the rest of your life.
Yes.
We need to realize this is not true anymore. We know that it's not true. It's hard to change it because people have this like anchored into their mind. If you cannot repair, you have diabetes, you have it for the rest of your life. You have Parkinson, you have it for the rest of your life. Anything, you have it for the rest of your life. And just our little study on the heart is kind of showing this is not true. A heart disease, you have it for the rest of your life. And here we're showing just give back to the body its own ability to repair, and the outcome can be quite impressive. So what I'm seeing as a change in the whole world of regenerative medicine is this thing that will really sink down in people's mind. This is not true. Your body has the ability to repair. And when we start to leverage this as a therapeutic strategy, we're changing the way that we practice medicine.
Yeah, and I think it's amazing because having seen it, my own situation, other people that I've seen firsthand, I've seen these miracles. I think there's a big education gap because especially like Alzheimer's. My mom has Alzheimer's, and it's like that's it, you're done. There's nothing you can do. But we know too that same thing. It's inflammation. They call it diabetes 3. But I think more importantly, it's this education process. That's part of what my podcast and the Man on a Mission is. The average person, like you're saying, oh, I got to go to the doctor. I got to get this pill. Where we just uncovered what it is the body has the ability to repair. And we're not getting it into all the different devices and telomeres, but the fact is I sit in a hyperbaric 4 or 5 times a week. I use an infrared sauna to get rid of my extra, whatever. I'm about to buy an ozone sauna, one of our, so I'm a proponent of all of it. In fact, you talk about glycocalyx. I have, different things. Bob Long has a company to test your glycocalyx. So, and talking about microcirculation. So all of it being something that's been educated. And this is what I appreciate you coming in and doing this, because I think the first thing people just don't know. They don't know what they don't know. And I think once they get the education, they'll be versus like, oh, stem cells versus, oh, I get it. This is how I'm going to heal myself. Stay away from surgeries. Stay away from the things that are causing me not to be, at 59, I got on stage and performed this Man on a Mission song in Times Square. If you told me 5 years ago, that's crazy. There's no way I'm going to do that. And it was because of me regenerating my body to that next level.
You mentioned Alzheimer's. It's an important one because it's kind of almost like a separate discussion of its own, although it's tied to what we talked about before. Right now, we're looking at what can repair Alzheimer's, what can reverse Alzheimer's. And the question that is not asked enough, you mentioned it, like inflammation, they talk it type 3 diabetes. We develop Alzheimer's for things that are so easy for anybody to remove from their lives.
Yeah.
One of them is inflammation. Like really use stem cells to repair all the microlesions so you stop producing inflammatory signal, so you get rid of this problem of inflammation, not by patching it, not by masking it, not by just improving a marker in your blood work, but by really removing all of this inflammatory signaling in the body, number one. Number two, there are drugs like statins. Like cholesterol is essential for human health. And this is like missed out of the picture so much. It's essential for membrane fluidity, like membrane health. It's a raw ingredient for some steroids. It's neurotransmitters. It is playing such an important role in brain physiology, and yet we try to reduce this cholesterol with this story that it's linked to our disease. It's this is another long discussion.
Yeah, sure.
It is not. It is not. Atherosclerosis, arterial problem, is not caused by too much cholesterol. It's caused by not enough stem cells, which then makes the cholesterol be part of the whole cascade. But if you repair this at the early stage in this process by repairing your arteries, your cholesterol is not an issue, and it's super important for brain health. So just do these things: exercise, repair properly to reduce systemic inflammation, stop reducing your cholesterol nonsensically, and then you're going to have an impact on Alzheimer's.
Amazing, amazing. And so let's talk about the product itself. And somebody watching this podcast says, "Hey, I want to find out
Mm-hmm.
more and maybe do an order and find that I want to take it for myself." How do we go about doing that?
Stemregen.co, so stemregen.co. This is the website where they can buy the product, see all the information, all the science. If they have any question, Stem Cell Christian on Instagram, and I have a team. If you put a question there, I'll get it, and then we'll answer all these questions. I've already answered many of these questions, but the website, stemregen.co, and all the products are there.
Yeah, and all the information, and it's really, it's really comprehensive. And you speak, I guess, all over the world. I know we
Mm-hmm.
met at Eudaimonia, which you were
Yeah.
one of the speakers there. So I'm sure, that's probably a big part of you getting the
Mm-hmm.
word out, is speaking to practitioners
Yep.
and to the general public. I just want to say this, to people, it's like, having been in this regenerative space, having done it myself, I truly believe that a lot of the healing, it's self.
Mm-hmm.
We do I came with a program after going to so many medical programs called Health, Wealth, and Self, because at the end of the day, if it's really up to myself, right?
Mm-hmm.
My doctors and half the doctors, as you know, aren't in the know. Our Western medicine doctors, when we would have this conversation, they would be like, "No, you guys are completely wrong." But there are a lot of doctors now, because the whole regenerative, longevity, biohacking is in everybody's face. The radar, the antennas are up. And I think it's exciting, because now there's the ability to have these dialogues, where before it was so closed minded, because it was like, we got to do a surgery.
Mm-hmm.
We have to do this. I have a friend who's, is an orthopedic surgeon. Hey, I got to knock any of these, where a stem cell injection, to tell you the truth, might have solve that, or your product in advance. Hey, I didn't need to get any problems.
Yeah.
I mean, I know guys in their 80s are like so healthy because they're in the gym every day, they eat right, they take care of themselves. You're like, that guy's 82. Yeah, well, he lives in Florida too. That helps, So, final word that you want to just say. I want to thank you again for doing this. I really appreciate it. I know you're super busy. But what would be the final word you want to tell a practitioner or just an individual looking for an answer, that, like, what would you say to them?
You go and see a doctor. So I'm speaking here both the patient and to the doctor. You go
Right.
and see a doctor. There's nothing wrong here. I'm just describing a process. The doctor will start to look and ask questions to see, am I facing like a problem that is a digestive system issue? Is it a flora issue? Is it a hormonal balance issue? Is it mitochondrial function? Am I looking at neurotransmitter imbalance? And then you go down the road trying to see what is the problem. Never in this inquiry is the question, is this person having a failure of endogenous repair? The ability to repair is not part of the inquiry. It does not exist today in medicine. And it's actually probably the most important part. What we're talking about here today is a massive discovery in medicine.
Yeah.
It's like discovering suddenly that the most important part in human health has never been part of the discourse on human health. So understanding that it becomes a diagnostic tool. Like, this person may have X problem because it has lost its ability to repair. And from a therapeutic standpoint, now it brings an amazing alternative, which is, or an amazing option, which is, let's start by boosting the endogenous ability to repair and see what this person can do on their own, on his own, before we start to put drugs and put other things. Let's just boost this ability. As we start to do this, we're going to change the way that medicine is practiced.
Very exciting. Thank you again. There's a man on a mission. We're here for the Eric Stoller show. Christian, thank you again, Christian. This is Eric Stoller for Man on a Mission. This is a man on a mission. Thank you, Christian Drapeau, founder of STEM Regen, here on the Eric Stoller Show. Thank you again as well to Top Doctor Magazine for putting this together. We're so excited to have you, and I think we have more podcasts that I think we can unpack. And again, we look forward to seeing you real soon on our next podcast. Go to stemregen.co to find out more. We'll drop our special code in the link so you can get a chance if you want to get a special incentive to sign up now. And again, I know there's programs if you're a practitioner to create a additional revenue stream for you, or if you want to get the product regularly, you can sign up and be a member on the site. Totally. Once again, Christian, thank you so much for being here. Eric Stoller at Studio 111 for the Man on a Mission podcast.